My name is Jeff Palesko. I'm a director at Karl Marx Advisors. The major factors affecting nursing homes in the U.S. tend to be Medicaid reimbursement levels and the changing patient mix, high cost of care, specifically related to minimum care requirements and staffing turnover, and high fixed costs, which are mostly associated with their rent expense.
Hi, my name is Mark Pfefferly. I'm a partner at Karl Marx Advisors. First of all, from a patient mix perspective, there's a big difference in reimbursement between private pay, Medicare, Medicaid, which has the lowest level of reimbursement.
What we find today is the patient is older and sicker than they have been in the past, which often results in requiring more care. In addition, the patient today tends to be more Medicaid patients, which often results in lower reimbursement rates.
We're finding a higher percentage of the healthier patients being treated at home, and in the case of, say, rehab, hospitals keeping patients or putting them into their own network. So what we're seeing is the acuity level at nursing homes actually increase. That has two impacts. Number one is a higher cost of care. Number two, they tend to be Medicaid oriented. Statistics show, as reported by Wharton, that 35 out of the states have reimbursement levels that are lower than the cost of care. So obviously, if you have a high percentage of patients who you're losing money on, it's a big problem. As your patient mix for Medicaid reaches the 70-80% level, it puts great pressure on the economics of the business.
The older, sicker patients require more care. That's more expensive. It also requires more of the staff.
Clinical staff, in particular certified nursing assistants, get generally low levels of pay compared to the market as a whole. In particular, CNAs have a very stressful physical and mental job, and this leads to high staff turnover. At the same time, states have been regulating and are increasing regulations related to the number of hours of direct care for patients. So the combination of those factors is putting increased pressure on cost of operation. Well, the industry, skilled nursing, is highly regulated in terms of both patient care and billing procedures when we're talking about CMS, Medicare, Medicaid.
Increased government regulation about the quality of care and minimum care levels for patients have required more of staff. They often perform routine unannounced audits on facilities that often come with high penalties and expensive remedies.
Many groups, especially the larger groups, have OPCO-PropCo structures where the real estate has been sold to a REIT or other real estate investor. These deals were typically done at a point in time where valuations were higher, and given the deteriorating economics, those rent structures are no longer affordable.
It's important for nursing home operators to restructure their rent so that it's right-sized with their organization. Karl Marx Advisors has a team of experienced professionals that can help to review and assess an operator's portfolio and look for ways to improve performance.
Essentially what Karl Marx can do to help operators is to deal with efficiency of operations, making sure the billing procedures are done to the highest level.
Account for all the care that they provide to maximize reimbursement.
Look at all the major subcontractors of the business, whether that be food, pharmacy, or clinical providers, and see if there can be any negotiations to reduce costs or to find other vendors.
Karl Marx has a team of professionals experienced in working with nursing home operators to review and assess an operator's portfolio and look for ways to improve performance.